Okay, everybody. Like I said, if you have any questions, feel free to ask them, or you can send something in the chat. I'll be monitoring the Q&A and the chat. We're going to go ahead and get started. So thank you guys so much for joining us. We have the lovely Melissa Frost with us here today. She is a physician assistant at the North Austin location, and she has been practicing in dermatology for over 10 years. I think she said 13 years, right?
Yes, sir.
So exciting. So I am so excited to have you here today
Thank
to
you.
share your wealth of knowledge about dermatology and acne specifically. I know we've talked a lot about this, and I can't wait for you to share all of that with everyone.
Sure.
A little, sorry, I'm so chatty.
You're good.
All you need to know about acne. So obviously it's not everything you need to know, but we're going to give you the down low on as much as we can. So we're going to go over acne specifically, the causes of it, what type of acne there are, treatment options, do's and don'ts, and then a little bit about acne scarring, because we know that every acne conversation usually leads to a discussion about some sort of scarring. And so first we're going to talk about what is acne. PA Frost, can you tell us a little bit about what acne is and some of the main causes?
Sure. So acne is something I think most of us in our life will struggle with, to some sort of degree at some point in our life, and that kind of varies with all sorts of different factors. The first type of acne that you typically will present with is comedonal acne. So you'll get kind of buildup of oil and dirt and things like that into the pores. A lot of times when left untreated, it can then progress to where you get the little red bumps from it, bacteria, and then you can get some of the deeper nodules and cysts. The thing with this is there can be hormonal influences and all of those different sort of things. But if we can start treating it early on, a lot of times we'll have better success in not having long-term scarring and that sort of thing.
For sure. And I know that in a little bit, we're going to talk about the do's and don'ts of acne. And a lot of that sort of stuff is kind of coming to my mind when you're talking about treating things early and kind of things you should and shouldn't do.
Yes.
So we are very excited. So let's see. So what's your type? So we're going to go through the different types of acne here. And as I was joking with PA Frost, this is a very elementary of some of the different types of acne, but we're going to use this as kind of a springboard into some better photos of different types of acne that you may experience.
Sure. So again, like I was talking about, kind of your first type of acne that you can present with will be what we call an open comedone or a blackhead. And so you'll get kind of little dead skin cells that will get caught into the pores, kind of our prepubescent acne that we'll see in our kiddos kind of starting even as early as like 9 years old. And so you kind of get that buildup into those pores. A lot of times, even just a simple cleanser and cream is enough to kind of cure this type of acne. But again, it's kind of getting it really early on and finding the right product for your skin type.
Definitely. And I think that's one of those things that we talked about seeing your dermatologist is a great way to figure out what type of product, because I mean, there are so many.
Yes,
Even,
it's overwhelming to
yeah,
go look at the counter.
has like 14 products and they're like acne prone skin line, and you're like,
Yes.
I don't know. So
Yeah.
definitely. So tell us a little bit more about the little sister here, whiteheads.
Yeah, so these are going to be kind of a closed comedone, or kind of like the previous photo, but something that's a little more encapsulated. So this is something where probably you've had a little bit more bacteria built up, can be more hormonal. Again, stress, inflammation in the body can be inflammation on your skin, right? Skin's our largest organ that we have. And so we don't see the inflammation that we get internally from stress, but on our skin, we do. And again, something fairly easy to treat if we can get it early on.
Definitely. I'm very familiar with these friends, unfortunately. So tell us a little bit about the next form of acne.
So the papule is going to be something that's maybe a little deeper into the skin versus the comedones that are more superficial. And so kind of similar causes, but this can be something that can actually cause more of a long lasting mark than those more superficial types. And the one other thing that can be a contributor, of course, is kind of the foods that we're putting into our body, not drinking enough water, processed foods, that sort of thing, for a number of reasons, but our skin is also one of them. So just again, treating it early on, preventing those scars.
Definitely. All I mean, sounds like the key to many of this is treating it early. So this kind of to me looks a little bit similar, but tell us how this one's a little different from the previous one.
Just slightly more advanced than the papule, right? It's had time to build up and create more of a white pustule. So it's deeper in the skin like a papule, but it's progressed to a point where now it's actually formed more of a bump on the surface. These are the ones that you definitely want to try not to pop, because that'll create a micro tear on the skin surface, and then again is going to cause more problems. But similar to that other one, just more advanced.
Yeah, the first thing that I see when I see this is kind of like a Pimple Popper
Yes.
situation. And then you kind of think there, that hand's there, like I wonder if it makes you want to squeeze it. And I feel like that's the main thing you always want to do when you see it and you're like, I want to take care of this. But I will say ahead of that pimple popper is doctor. So that's a trained professional dermatologist that knows how to deal with these. So we
Yes.
all can't be Dr. Pimple Poppers.
Yes.
And we'll talk more about that in a second. So tell us a bit about cysts.
So the cyst, many times in in my clinical experience, it's going to be more hormonally driven and kind of genetic. And so we tend to be a little more aggressive when you present in the clinic with something like this, because again, this is going to leave more of a mark. So yes, some of the different creams and things like that are good, but sometimes we have to be more aggressive in treating things like this, because these are even deeper in the skin than those others that we saw before.
Yeah, definitely. It shows like a whole other texture to the skin.
Yeah.
And I personally had some of this, so I know how like tender and uncomfortable it can be because it feels like it pulls the skin so tight.
Same.
So
Yes.
definitely the ones that I had to reach out to my dermatologist friends to get some assistance with.
Yes. And then nodular is very similar to cystic. Sometimes you'll get these cysts that can kind of, you'll have so many in an area where they kind of conjoin underneath. And so you'll get an even larger mark on top. So similar to the other one, but again, just more advanced.
Gotcha. And you keep saying similar to the other ones. And what's really funny to me is that we mentioned at the beginning and how important it is to
Yeah,
go to your provider to talk about this because they all are so similar. Uh,
correct.
they all present very similarly, except for maybe one or two of them, or like easily identifying like a blackhead versus a whitehead. But the rest of them pretty much look the same to me, to
Right.
the untrained eye. So
Yes.
how important it is to know whether or not it's something that needs more of an aggressive treatment or something that could be just a plain, uh,
Cream or wash.
yeah,
Yeah.
for sure.
Yep.
So now that we've learned a little bit about the main types of acne, let's chat a little bit about some of the treatment options that are available for these things.
Sure. So a lot of these first are going to be targeted to kind of that oil control. So we have benzoyl peroxide, salicylic acid. Those are we call keratolytics. So those are what kind of like break up those dead skin cells to kind of clean out the pore. A lot of times we'll kind of conjoin or add that with maybe a topical antibiotic or some retinoids, which also will help kind of clean the pores out. So it's tricky because there's so many products, like you were saying, over the counter and prescription as well. And I always tell my patients, treating acne is like peeling an onion. Like, how many ways can you peel an onion, right? Like, lots of ways. And so treating acne is similar. And that's why getting a good history and connecting and kind of talking about like what your skin type is and all the different questions that we're going to ask you will kind of gear us in the right track to getting you on the right treatment that you need.
For sure. And then talk to us a little bit more. So we talked about kind of like the oral topical medication route, which that second one is supposed to say topical meds, which I'm looking at it and it's bugging me now. But tell us a little bit more about some of the more aggressive treatments like an injection. Like when would that come into play and what is
Yes.
that about? And then also kind of like chemical peels and some of the other like more progressive methods of treating acne.
Sure. So sometimes when you come in and we need to be more aggressive, kind of the first line therapy is like an oral antibiotic. Depending on how aggressive it is, we can start with a high dose, or sometimes we can even get away with doing a lower dose. So there's a lot of different kind of leeway with that. If we feel like we're at a point where we're risking long-term scarring, we'll talk about Accutane, which a lot of people have read all the bad stuff about online, right? Like, oh my gosh, Accutane, it's so bad. It's actually a very high dose vitamin A derivative. And so now we know how to monitor it with blood work and monthly visits to where we prescribe it very safely. And so it's not something to be scared of, but it's something to kind of keep on the table to say, okay, if we're worried about this long-term scarring, this can be an option. Now, if it's more hormonal, we might talk about something like spironolactone, which is geared towards kind of stopping that hormonal component. I don't always like to jump to birth control pills. A lot of times we'll kind of refer that to the PCP just because that's a whole other like box of treatment of things. But the spironolactone is more of like hormonal only. Now, if you come in and you have a really big cyst or nodule, the injection's great because it's going to knock it out literally within 24 hours. I will say in my practice, the times I do the most injections, especially for young teenagers, are like right before prom, right before homecoming. It's like, oh my gosh, I've got to dance, I need to get in. And those are such a quick, easy appointment that if you need to get in same day, most of the time we're going to be able to do that for you. And people are like, oh my gosh, I wish I would have known about this. I didn't have to suffer for 3 weeks with this huge thing on my cheek. So that's a good like short-term measure. And then that kind of leads us into, okay, here's like a long-term plan. Now, after we start to really get your acne under control, there's so many other things like the chemical peels. I don't know if we are doing a ton of the light therapy right now, but our nurse esthetician Misty does a lot of the peels and things like that. And then of course, the scarring, then we can kind of talk about that after we get things under control.
For sure. Yeah, I definitely have been there for an injection, and I can say that it does help, especially for those ones that are uncomfortable or if it's really
Yes.
bothering you. It's very quick, which is very nice. But yeah,
Yeah.
definitely something you would need to reach out to your dermatologist to figure out. So I asked you before this to give me kind of a little list of some of your like favorite acne products, just because I know that that's one of the main things people are going to want to know, or like, what should I buy for
Sure.
acne?
Sure. So the CeraVe products are a great one that are easily accessible. You can get them, HEB, Walgreens, Target. They're non-comedogenic. They have a line for normal skin, oily skin, and then they also have, the lotions and things like that with sunblock, without sunblock. So that's a good, just kind of basic product. Now, if you want to like step your game up, then you come into our office and we have some other products like the Elta MD products, which are fabulous. And then couple other that are like our specialty ones where if you're like, oh, I want to step up my game just a little bit, this Isden sunscreen is great because it also has things to kind of fight like anti-aging and just really good sun protection. And then there's another product I didn't get typed in here, but our Skin Medica HA5, it's a hyaluronic acid. So it's simply a humectant to help draw in moisture because with our acne, the products are going to dry out the skin, but we also have to kind of replace the moisturization that we're kind of taking out with our treatment. So it's a fine balance. And so that's another one. The one here on the far right of the screen, Phoenicia, it's a really nice, so azelaic acid. You can get it over the counter in lower percentages, but prescription, we have higher percentages. And it even comes in a foam now, which is absolutely fabulous. It's like a game changer for me for my acne, where if you don't tolerate Retin-A, which can be very drying, it's kind of an alternative to that. And it helps with pigmentation from the acne marks that are healing and exfoliating, all those things. So that's actually like one of my favorite go-tos when it's like, oh my gosh, I've done everything. But I'm like, have you tried Phoenicia? I haven't. Well, let's do it. And
That's
it really is super successful.
Yeah, I love it. It's so funny. I have friends that have specific products that they've gone to their dermatologist and they prescribed for them, and they like swear by them. They like use
Yes.
the full like prescription name. And I'm like, you have bought into this, but if it's working,
Yeah.
fantastic. I'm happy that you're so excited, but that's awesome. So thank you for sharing those with us. And like I said before, we do have 15% off of our acne skincare products at shopmdskincare.com. And that's going to be a temporary thing. There's a acne 15 is the code, and that went out before this, and then will also go out afterwards. And some of these products will be there. So make sure to check those out afterwards. So I led up to this earlier, but this is one of the best parts of the presentation, I think, are some acne do's and don'ts. These are things to either do to assist with taming your acne, or to not do for fear of getting it angry at you.
Yes.
So tell us a little bit more about some of these do's.
Yeah. So, like we talked about, the first step is going to see your dermatologist to figure out what is going to be the best for your skin type. Because, like we said before, there's thousands of products. And when you go through and try all these different things on your own, sometimes it's very frustrating. So I think getting on the right treatment plan, number one. Number two, trying to just be consistent. I'll tell some of my patients, get a little basket, cute little basket, and put all your little products in the basket on your counter. That way it looks, it doesn't look cluttered, but you're more apt to use them when you can see them every day and they're not shoved in your drawer. Cleaning regularly, I mean, just trying to make that a part of your routine. Brush your teeth, do your moisturizer, making sure you're cleansing. And then I commented on this before, don't be afraid to moisturize, because I think a lot of people are afraid that's going to clog the pores. If you're on the right product, it's not going to do that. And it's actually worse if you don't, because those skin cells are more apt to get caught into dry pores than they are into nice hydrated pores. And then kind of that last take home point, non-comedogenic products. I think, back even 13 years ago when I was practicing, I don't think they were as good at labeling and marketing products that way. I think now they have done a better job of that. And then the products we recommended are all non-comedogenic.
Which is great, because
Yes.
those ones don't block the pores. They allow your skin to breathe, which is great.
Yes.
I will say personally that moisturizing is one of those things that I don't think about as often, because I feel like if I have oily skin, and so I'm worried that I'm basically like making my skin more oily, but that's not how the science works.
Correct.
Which is why you have your job and I. So thank you for sharing those. Let's talk a little bit about things we should not do.
Right. So I think all the things that we're tempted to do initially are kind of where you need to like say, okay, wait, no, I need to just use my product. So anytime you like get that 10 times magnifying mirror up really close and you think, oh man, I really just want to get that out. Yes. Right. And so tempt yourself to just say, okay, I'm just going to do my routine, cleanse, medication, moisturize, and just kind of leave it be. If you need to come in for an injection because you have you have a big meeting, you have a big event coming up, come in and we'll take care of you. And then, sun exposure that makes acne better. That is true that light treatment and sun makes it better, but now you're getting sun damage on top of your acne, and then it's just going to be a vicious cycle. So, yeah.
For sure. So to double down on this, exfoliating with acne. So just kind of clarify this for me, because in my head, I'm thinking like, if my pores are clogged, that's probably what's causing the acne. So explain a little bit more why exfoliating your acne may not be a good idea.
You're going to get more micro abrasions and like micro tears on the skin surface. So you're actually creating more trauma, which is then going to in turn cause more inflammation. And so in the moment, it may look better, but then several days down the road, you're going to get more damage to that skin surface. And so it's hard to see in that moment, but long term is then when you're really going to, and then you're, dang it, I wish I wouldn't have done that. And, we've all done that once or twice, but yeah.
Well, thank you for clarifying. Yeah, that's
Yeah.
super helpful, super important information. So we talked a little bit about that. Speaking of micro tears,
Yeah.
so we talked a little bit about acne, and I feel like a lot of those different types of acne, and I feel like the majority of us, even if you have moderate acne, can end up with some type of scarring. So I felt like we'd be doing an injustice to not kind of mention, talk a little bit about scarring, and then what opportunities there are available for treating those. So like I know it says it here, but just give us a brief explanation of like the main causes of scarring from acne.
Right. So, I mean, you can see kind of a lot of the like ice pick scarring kind of in that like top left photo where they're just like little divots, right? And some of that unfortunately can be unavoidable because of the untreated inflammation in the skin. The one in the center where you'll see those deeper pocks, some of those can be from trying to squeeze, especially those deeper papules, pustule cysts. And so, because when you squeeze, it causes the epidermis to tear. If you were to look under like a high density microscope, you could see it. And then that's what's, as the healing process, going to cause like this dent into the skin. And so that's what is kind of going on in the pictures there.
Which is crazy because, like I said, I would have never thought that inflammation would have been the cause for a lot of this, but it sounds like that's one of the key issues with acne
Yes.
itself is not necessarily the bacteria, but even just the inflammation, especially when it comes to scarring.
Yes.
I do have a quick question here about facials. Um, it says good, bad, what kind are recommended when it comes to facials?
Facials are tricky because when you go to a spa or that sort of thing, they're mainly doing them for like hydration and kind of like overall smoothing the skin. Sometimes, if they're not exactly sure what type of acne they're dealing with, like some of the different acids and things like that can make them worse. And the extraction process where they're using those tools, they can be okay in some scenarios, but unfortunately, because they can cause more inflammation, then they can actually cause more scarring.
For sure. And that's why I personally find, and this is kind of how I feel comfortable, is visiting an esthetician that kind of works in a medical location because then they do have access to those top tier providers that can be a backup for them if they need it. And they're
Yes.
also trained medically to assist with these specific situations where and have access to specific types of acid or specific types of products that are dermatology grade that not everyone may have access to. It's not, some of them can be more medical than frou-frou, which is very nice as an ancillary to your treatment with your dermatologist.
Right. And I agree with that. Like if I were recommending a facial, it probably wouldn't be to an acne patient. It would probably be for someone that just wanted to go relax and their skin didn't really have a ton of that sort of problem.
Super, super helpful information here. So back to the acne scarring. So we talked a little bit about what might cause a scar. So then we've also got here listed some things that you can do after scarring occurs to assist with minimizing the appearance of those scars.
Yes. So, kind of the first thing that people will think is a scar, but it's actually something called post inflammatory hyperpigmentation. So, after you have a bump, even though it's healing from even the treatments we've given you, it leaves like a little pink or red mark, but no indentation or bump. So, those are the different things like retin A, finacea, the chemical peels that kind of just help exfoliate and smooth out that top layer. Whenever they're deep and you see a bump or an indentation, that's when we really have to kind of bump it up to like dermabrasion, microneedling, that sort of thing. My best analogy, because I love to garden, is like aerating your lawn. So when you get your lawn isn't doing well, put little plugs into it. And that's essentially the microneedling, puts little plugs into the skin. But we also have something that is called microneedling with PRP. And that is where we basically take some of your blood and put the little plasma cells back into it. It's like fertilizing your lawn. So not only are you doing the little plugs, but you're fertilizing it. And that kind of helps the collagen rebuild and give you a smooth surface on top. Now, if you get anything that's more aggressive and those things are not going to be enough, we can sometimes do the dermal filler to kind of get one of those bigger pock marks out. We've done that for like chicken pox scars or shingles scars as well. And then the laser resurfacing, which of course is going to be even more aggressive.
For sure. And that's one of those things that you can visit your dermatologist or your licensed medical esthetician and certified laser technician to chat about because there are a wide variety
Yes,
of laser resurfacing options and they all target different things. Some of them target more texture, some of them target more your pigmentation.
correct.
So that is a whole other conversation.
Yes.
Well, awesome. Thank you for sharing that. So we have reached, if you guys have any questions, I'm about to give kind of a little bit of a spiel on the Austin Institute for Clinical Research, which is a affiliated company of ours, and kind of close out. But if you have any last minute questions, I'd love to ask them to PA Frost before we leave today.
Sure.
So as you're doing that, I did want to say we are affiliated with the Austin Institute for Clinical Research, which is a phenomenal opportunity for you to be involved with how medicine changes, which is one of the coolest things. I get goosebumps when I talk about it. They basically bring you in. There's an opportunity, depending on the trial that they're doing, for you to receive the treatment for free, to receive compensation for your time and travel, all while treating a condition that you have already, which is really great. And I know that a lot of the times they are doing something with acne. So if you visit atxresearch.com, you can see what they're doing clinical trials for. And I believe we have multiple locations within the Central Texas region that offer that. So that could be a really good opportunity for you if you have the time to do it, or if you're interested in helping out. Also, scheduling an appointment is super important with your provider, and then regularly seeing your provider. Sometimes if you're doing something for a long time and you notice that things aren't really moving anymore, maybe it's time to step it up a notch. Maybe it's time to try something else. And then also the raffle, like I said before, we're doing a very exciting L to MD raffle. So we will be giving that winner a call within the next few days, which is super exciting.
Yeah.
And then shopmdskincare.com, use code acne15 to save 15% off of any of the products in the acne category. So PA Frost, do you have any last words for us before we head out today?
No, I hope that everybody got a little extra information that they didn't know before the presentation, and that we would love to see you in the clinic.
For sure. And thank you so much for taking the time. You've cleared up a few questions that I personally had. You explained it phenomenally. I loved your explanation of microneedling as aerating your yard. That is like a keeper. Um,
Right.
Thank you so much for your time, guys. Have a lovely one. Look out for follow emails from us for future events. And we can't wait to see you. Stay safe.
All right. Take care.
Have a great one.
You too.